Let's talk about the development of heart. So this is the model of the heart in the sequential arrangement. So we will start with this. The heart tube is originally a single tube, and the part that it has are sinus venosus with its two horns. Then there is atrium and ventricle, and then there is bulbous cordis. It's further three parts, and then it ends with the aortic arch. So in the original, in the anatomical position, the inflow is in this direction. Initially the blood comes from here through the two horns of sinus venosus that is just lying above the septum transversum. It enters through here, goes to the through SA opening, sinoatrial opening. It goes through the atria, then through atrioventricular opening into the ventricle, and then to the bulbous cordis. All the way it goes to the aortic arch. So its position is somewhat like this in anatomical. So this is the anterior, this is the posterior. As you can see, the coiling has been started. The atria have started to go up and back as compared to the ventricles. The outflow tract that will come forward and downwards and to the right. So it is going that. So a little next step is shown in this model. So as you can see, as compared to this one, here the atria are at a little highly placed position, and the ventricle, the outflow tract has come a little down. So as this goes on, the outflow tract starts to come in the front. So they're in the front, they're in the back, and you can see the different dilatations, they become more prominent. You can more clearly see the demarcation between the sinus venosus and the atria. Here is the constriction between them. You can see the constriction between the atria and the ventricles, the AV canal. And then there are the three parts of bulbous cordis, the proximal, the middle, the distal one. And basically this is the middle one, this is the distal one. That is going to ultimately, if you see in the anatomical position, so is comparable to my body. So here, sorry, this is the anatomical position compared to my body. So this part of the vent, this will become the future atria. This will become the future ventricle. As you can see, this is my left hand. This will become the left ventricle. This part of the bulbous cordis, this will become the right ventricle, and between them, this groove, this will ultimately begin to go in to form the interventricular septum. And this is the right ventricle, this is the left ventricle. This part will become the outflow tracts of both the ventricles. In right heart, there will be pulmonary conus. In left heart, there will be aortic vestibule. And then this part, the distal part, will become the start of the aortic arches and the pulmonary trunk. So now moving on to this one. This is a little more, the rotation has been almost complete. As you can see, the atria has come to the back. The outflow tract has come to the front. So this is the outflow tract that we saw here and here. It has come to the front, and when it comes to the front, it pushes back on the atria, rudimentarily dividing them into two parts. So this atria, still it's a common chamber. So this is still a common chamber, but it is now somewhat divided between the right and left parts. So this will in the future become right atrium. This in the future will become left atrium. Here you can see somewhat equal distribution of the ventricles is now seen. This original ventricle shown here, here, and here. This is going to become the future left ventricle, and this part of the bulbous cordis you see here, here, and here. This is now becoming the right ventricle. And apart from that, as you can see from the back, one more thing that is happening. This is from the back. Now this is from the back. Sinus venosus were originally very separate here, somewhat incorporated here. As you can see, sinus venosus has pushed forward into the atria. Now it has become the posterior wall of atria, especially the right atrium. It is not a standalone structure as you saw here. And moreover, as you can see, this half, the right half, is now more developed. This is the one that is going into the right atrium. This part is the left half. Originally, it has three inputs, the Wittline, the umbilical, and the cardinal veins. Now, as you can see on the right side, so as you can see from the back, this is the right side. On the anatomical position, this is the right side. So the right side, you can see this is the cardinal vein surviving that is going to form the superior vena cava. And then there is the right Wittline vein. You can see this being more prominent as compared to the other ones. because this is the one that is going to form the uh, part of the inferior vena cava. And the umbilical veins have almost regressed, and the wetline vein on this side has gone, and it somewhat survives for now, but it will go to disappear eventually. So this is the part, the left part, that is going to form the coronary sinus. Now, next part, this model is almost the same as that model, but now this step has shown the same stage, but it has opened the chamber for it, and to show what's happening inside. So what's happening inside? This part is shown that the two primitive atria are being separated. This is the right atrium, this is the left atrium. The same thing has been shown here. However, the ventricle, if you can see, this is the primitive ventricle that is going to form the future left ventricle. This is the proximal part of bulbous cordis that is going to form the right ventricle. So here you can see the initial part of the interventricular septum, that is the membranous part of the interventricular septum. Here you can see a little ridge between them. Here it is called bulboventricular flange. So it is shown here. This is bulb, this is ventricle, bulboventricular flange. So this is the part that is This is currently the interventricular septal defect or interventricular opening. So this part, it has grown a little up. As it expands down, this septum will remain at this point. The chambers will expand, so here the membranous part, muscular part of interventricular septum will form. So we'll see it shortly. The rest of the model, you can see it's the same thing. The right horn being more developed as compared to the left horn. Now, this is a slightly next stage. These two are similar in stage, and let's focus on this one as it shows the external features. Now you can see the development of symmetry a little better. You can see a little well-developed shape of the atria, these extensions that are going to form the auricles. This is the area that is going to form the auricles that goes anteriorly, and the same for the left atrium. On the then there is the outflow tract that will form the aorta, and here you can a little better you're able to see the chambers. This is the right ventricle, this is the left ventricle. This is the left ventricle, mechanically speaking, right ventricle, outflow, and this is the middle part of the bulbous cordis. This is the distal part of the bulbous cordis. So these are it. In the back, you can see now a little remains. On the right side, as you saw previously here, the cardinal vein, the anterior part of the cardinal vein, it becomes a superior vena cava. Here, the Wittline veins that remain, the right Wittline vein, that becomes the inferior vena cava. You can go into the discussion of the vena cava, what other parts are formed. So you can see the vena cava, almost other things have disappeared. You cannot see any further the umbilical vein. You cannot see it here. You cannot see the Wittline and umbilical vein on this side. You cannot see it here. This is the part that will continue to grow smaller and smaller. This part, this half, left half will become the coronary sinus, and some of its branches will become the branches that are left vein of marshal of the atria. That will become those parts. So these are regression has been shown there. Now let's see what's happening inside. Now the major item of and this one. This is a new thing that has appeared. These are the pulmonary veins. Pulmonary veins does not come from any of these existing structures. They come from the original dorsal mesocardium, that is the mesentery of the heart, and they develop from there. And you can see the original two pulmonary veins uniting here. You can see it right here. They are joining, and they are going to open into the left atrium. Then now this is the same stage. It is shown in this, but the anterior wall has been opened. So again, for the revision, same things are happening there. We have superior vena cava well developed, as saw here. This is a little advanced than this. Superior vena cava has developed from anterior cardinal vein. Inferior vena cava, they have become more aligned and they have incorporated to the right atrium. And then there is pulmonary veins. This is the left horn of sinus venosus that is going to make the uh, left coronary sinus. And as you can see, its distal parts are getting embedded into the atrial wall that will make the walls of the atria, veins of the left atrial wall, and here it will feature in the form left coronary sinus. So what's happening inside? Let's ignore the details for now. Just look at the chambers as a whole. You have now left atria and right atria, as we saw it here. The left atria and right atria, we have the two atria. This pulmonary vein, as we saw here, it's opening here in the left atrium. This sinus venosus right horn, as we saw here, this is now opening here. This is the sinus venosus. My pencil is going inside the. This is now, this opening is now called the sinoatrial opening. This is called the sinus atrial opening. Now, this whole wall from here to here, this whole structure, this is the AV canal, atrioventricular canal. It's the AV canal. And as we saw here, then there was a dividing between the right and left ventricle. From that point, both ventricles they expand downwards, and the point where they were two meeting, that particular point does not go down. So we can see as the chambers are originally in this model, this chamber was ending right here. But as it's expanding down, this point, if you can see, at this point we saw here, this one, it remains in its original place. On the sides that goes down. So if the middle one does not go anywhere and the side ones go down, this is the start of the formation of the muscular part of the interventricular septum. As you can see, as the chamber goes on, this point will remain here, and as this chamber goes here and here and here, the septum between them will start growing. And that is why this septum can never fill this gap, because this is not actual a growth of a septum. This is basically an opposing wall between two expanding chambers. This is the right ventricle is expanding here, the left ventricle is expanding here, and in between them, these two opposing the opposing walls, these are the ones that are going to form the then here the item that you are seeing here, this is the endocardial cushion, and this is the one that is going to divide the AV canal into two parts. The part that is going to make the right AV canal and left AV canal. This is the start of it. As you can see, that will be the dorsal endocardial cushion. Now let's bring a focus on here development of atrium. Now this is the sinoatrial opening. This one, it has two lips, the right lip and the left lip. The right valve, more specifically shown, the right atrioventricular valve, so sinoatrial valve, left AV valve. These are the things here. This is the new thing that has started to emerge. This is the septum primum. This is a septum that grows from the midline down to the endocardial cushion. As it grows down, there is a gap between this endocardial cushion. This is the endocardial cushion. This is the gap between the septum primum and the endocardial cushion. This gap is called the first foramen, ostium primum, foramen primum. So now in this model, now you have the two atria. Right atria have right SA valve, left SA valve, septum primum opening, that is ostium primum, endocardial cushions, and endocardial cushions are also developing on sides also, that will go into the formation of the valve. There is a left atria and there is a pulmonary opening, and keep in focus now that here the pulmonary opening is single now, as the two veins that are coming, they join and they enter and they fuse, and single pulmonary opening comes here. Now in the next step, what happens? And let us focus on the atria first, and we'll go back and see the other things that are happening down here. So let us focus right here. So let us look at this septum primum only. We saw the septum primum here, and I think that's okay. We saw the septum primum here. The septum primum goes down, it grows in this way, and it ultimately joins this endocardial cushion. As it goes down and joins the endocardial cushion, the ostium primum, the opening between the septum primum and the endocardial cushion, it disappears. But for coronary circulation, for fetal circulation, it's necessary that opening remains between the two atria. So what happens is, another opening is created within the septum primum. This opening as shown here. Another opening is created within the septum primum. Now this opening starts at little perforations. As it grows, all the perforations they join and they form a large opening. So this opening is called ostium secundum. This is the ostium secundum. Now another event that is happening is this yellow item that you can see here. This is the septum secundum. When all of this has happened, actually these are from educational point of view, we tell them separate, but actually they are occurring at the same time. Then on the right side, on the right atrial side, another septum starts to grow from above downwards. This is called septum secundum. This is the septum secundum. As the septum grows, there is again similar manner. There is a gap between the lower margin of the septum secundum and the endocardial cushion. That gap is never fully filled. The septum starts growing down, but it stops well before reaching the endocardial cushion. So that gap that is created, this gap that is created, this is called foramen ovale. Foramen ovale. Now the septum primum, as we discussed earlier, has ostium secundum on the top of it. The superior half, there was the opening. That opening grows larger and larger and larger, so much so that for practical purposes, only the lower half of septum primum survives. So on this side, septum secundum was growing. On this side, septum primum was regressing. So as the septum secundum grows down, on the lower half you are left with foramen ovale. On the left half, you are left with, in the lower half, you are left with septum primum that actually covers the foramen ovale created here. That item, that situation is shown a little clearly, more clearly in this part. As you can see, septum primum is only left with this opening. Here you can see yellow through the septum primum. So that was the original upper half that has regressed, and that was the original ostium secundum that remains. And on the right half, you can see it grows all the way down except for this part. You can see the color of the septum primum here. So that gap is the foramen ovale. As the blood tries to flow from the right atrium to the left atrium, it pushes the right atrial wall, it pushes the septum primum. Like if I make it a circle right here from the septum secundum, and here is the septum primum. As the blood grows from right atrium to the left atrium, septum primum, the original lower half of the septum primum, it just gets out of the way. But if the blood tries to go back from the left atrium to the right atrium, it shuts down. So that is the about the septum primum. So that's all about the interatrial septal formation. When asked about the question, you will go through this. You will first explain the septum primum, then you will say what is ostium primum, then you go on to explain what is the ostium secundum. Then you will start with the septum secundum, then you will talk about the foramen ovale that is left on the lower half, and then in the end you will conclude that the foramen ovale is only left, that is covered on the opposite side by septum primum, and that one way the one way blood valve is created. Now there are another two questions from the exams that are asked about here. Now this part, the part where the lower margin of the septum secundum is, this arc, this part where the lower margin of septum secundum is and the fossa ovalis ends and fossa ovalis start. This is a raised part. This is called, in the adults, this is called limbus of fossa ovalis. This is the upper margin. So in the embryology question, you were asked from which structure is the limbus of fossa ovalis developed. So your answer will be septum secundum. And then another question is, which part of the atria forms the floor of the fossa ovalis? That is made by the septum primum. So foramen ovale is the gap in the septum secundum, and fossa ovalis, the floor is created due to the valve on the other side. Now let's see what has happened in the last two pictures for the rest of the atria. What happened is that here you can see, as compared to this picture, yes, as compared to this picture, this opening has grown on each step. As more and more of the sinus venosus gets incorporated into the right atrium, this opening gets widened. This goes, the right valve of the sinoatrial valve goes to the right further and further. The left one goes to the left further and further until the left one goes near the septum. and it merges with the septum. And in this, you can see there is no more left sinoatrial wall because it merges with the septum secundum as it grows. And now this part, this whole part of the atria now, between the septum and this right SA valve, this whole valve is now derived from original sinus venosus. In adults, this whole part is now called sinus venarium. And this part, the right sinoatrial valve, and this is the demarcating line between the original atria and the new part of the atria that is coming from the sinus venosus. Now, this in adults anatomy that is called crista terminalis. On the opposite side, if you see the outside, you can see this groove. This is circus terminalis, and the top of which you will in adults you will see there is a presence of SN node. So this is the demarcating line that divides the SNO, this the two parts of the atria. Here is your another question: how the right atria is developed. Right atria is developed from the rough part from the original atria that we followed all the way till here, and the smooth part has developed from the sinus venosus that we started here, but it got incorporated. As you can see, if we see these pictures again, it is going more and more inside. As you can see in each successive picture, on the exterior you will see less and less of sinus venosus outside because it has now incorporated into the right atrium. So this is about the right atrium development, and let's talk about the sinus venosus here also. The left one of sinus venosus, as you can see, it has now taken a very prominent form as the coronary sinus. There is a left ventricle, there is a left atrium, and between them there is a coronary sinus that is going to ultimately open here into the right atrium. And these vessels here, the cardinal veins and the other vessels that were here, they have become the veins of the heart, the vein of the atrium, the vein of the ventricle. These vessels have now become the veins of the heart. Now we are left with the left atrium. Here, you saw that Okay. You saw that the pulmonary veins, how many were there? They joined and fused as a single opening they had opened here. But as the atrium expands on the right side, it was as it was expanding, it was engulfing the right sinovenosus. On the left side, it has now engulfing the pulmonary veins. As you can see in between these two pictures, now in this model, more of the pulmonary vein has been incorporated as compared to this one. As you go further, more of it has incorporated, and you can see that as first bifurcation is involved, then there is two vein, you will see two pulmonary veins. As a second level of bifurcation for each of the right and left is involved, you can see four opening. So now here is your second question, that how the left atrium is developed. You will say that the rough part of the left atrium will be developed from the original left atria that we followed all the way from here, and this smooth part that is mostly seen on the posterior aspect that is receiving the pulmonary veins, that is derived from pulmonary veins, that is developed from pulmonary veins, because as the atria was expanding, it was incorporating pulmonary veins inside. Now let's see, one more thing has happened here: endocardial questions. As you can see here, the endocardial cushion was a ridge between these two. It and the endocardial cushions and conotruncal septa. These both things are uh, grown, and their development is guided by neural crest cells. So they not only grow in front, and then the two meet, the ventral one and the dorsal one meet to divide the AV canal on each side. Not only that, they grow upwards and they grow downwards. As they grow upwards, as they grow upward, the actual closure of foramen ostium primum that we talked in the beginning, this was the ostium primum that we talked about. The final closure of the ostium primum is due to the upward growth of this endocardial cushion as it goes up to meet the septum primum. As you can see right here, it goes up and it meets the original septum primum. So the original ostium primum is closed, and it goes down also. It goes down and it meets the muscular part of interventricular septum. Here is the developing muscular part of interventricular septum, and here it has met the muscular part of interventricular septum. And so this is the one, that is the part that is making the membranous part of interventricular septum. Here the two ventricles are still expanding, the abutting walls between these two, they are growing more and more. This is the muscular part of the interventricular septum, and here the endocardial cushion that has grown down, this has now joined this upper part and made that. On each side, the swelling on each sides, there are first simple bulges, and then they get trimmed further and further, and below them they get cavitated and chorda tendineae remains, and above there is flat surface remains, and they here are the leaflets of the vein walls that are being formed. So any issue with the neural crest cells, any issue with the endocardial cushion may result in the issues of these walls. It may result in the improper division of the AV canals. They may also interfere with endocardial cushion coming up and meeting with the septum primum, resulting in atrial septal defect. It may interfere with it is growing downwards and meeting with the muscular part of interventricular septum, leading to the what ventricular septal defect. So that's so much established now. So let's go further. So here now this is now cut coronally a little more anteriorly to show you the outflow tracts. Here you can see the outflow tract, the atria has been developed on left side, the septum primum, and these structures are available here still. And this the sinus, as a nodal opening, all of these structures as we discussed, they are present there. And here there are AV openings, the right AV canal and the left AV canal that are being made. Now, currently, before there is division, these two AV canals, they are commonly opening in the midline. They are commonly opening into the both chambers, the right ventricle and the left ventricle and the right ventricle. As the endocardial cushion shown in the red here, as they grow further and they meet one another in the middle, these two canals will get separated. This half will open only here and this half will open only here. So endocardial cushions develop here. And this is the ventricular septum. It's actually somewhere, technically speaking, it's somewhere here. This the process that we're talking about is somewhere here actually in the model. So now one more thing that happens is that this outflow tract, currently there is a common outflow tract right now. This is the proximal part of the bulbous cordis. This is the middle part of the bulbous cordis. This is the distal part of the bulbous cordis. Currently, both of the ventricles are from the anterior aspect. This is the left ventricle. It is giving its blood from here, and the right ventricle from here. All of both of these are going through this, and they are not separated right now. Ultimately, these are the aortic arches. Here is the pharynx. My pen, this place, here is the pharynx. And the aortic arches are ultimately going to go from either side of the pharynx and the foregut and go back to the dorsal aorta that are running here and here. So this has now ultimately this part, these pulmonary veins have to be separated from the aortic arches. To do that, nature had developed this. These are conotruncal ridges. This is a conotruncal ridges. This is the conus part, this is the truncal part. Within these two parts, the conus part and the truncus part, the ridges develop. As you can see, they are spiral in nature. If you look inside a little, you may be able to highlight that, like this start here and it will go up and it will ultimately go green one on the right side, it will go to the left side here. This one goes to the back wall and go to the opposite side. This is shown a little more clearly in the next model here. You can see these ridges have now grown a little more. So here you can see the spiral very clearly. It starts from the right, goes from the anterior wall and goes to the left in the top. As you can see, it is on the right here, but if you see here, it's now on the left. It starts from the left here, curls around, and if you can see from here, it's on the right now. Now, these two chambers, this is the left ventricle and the right ventricle, these are going to be separated by this. As they grow further and these two ridges comes close together, so in this a little more, now interventricular septum has been developed. Not only the interventricular septum is made up of endocardial cushion, but also these two septa join to form here. Let me show you this, and this is the last one I was going to discuss. So here is the septum, they grow more and more close together. Then here, this is the outflow tract of the right ventricle now. The right ventricle flows here, the blood goes from here outward, and as you can see, initially the right ventricle is in the front, pulmonary vessel is in the front, but as it goes from here down, it will ultimately go towards the back. So towards the back, the pulmonary vessels are going to be the back on the top, and this is due to the spiral. Thanks to the spiral hinges of the conotruncal septum, the blood from the anterior aspect goes to the left of the aorta to the back of the aorta until it reaches to the back, the pulmonary veins that you can see in the adults. This is the picture that you see. The same way, the left ventricle, its opening is far back behind. You can see it here actually. It starts from here, it goes on the posterior aspect of the septum, but on the posterior aspect of the septum, it goes behind the septum on this side. Ultimately, it reaches the front here. From that, the aortic arteries, it will expand it. Okay, so that's that. And here, that's almost the final form that is seen here. Now the septum have almost joined with one another. Not only that, you can see here the complete membranous part of the interventricular septum now. In the red, that is shown the endocardial cushion that originally fused down, come down and fused with the membranous part of interventricular septum. But you can see this, the green and the blue one. These are the two conotruncal septums that also come down and fuse with that part. So whole of the right heart now with this fusion, whole of the right system is now separated from whole of the left system. The blood will come from the right atrium through right AV opening to right ventricle to anterior aspect of the conotruncal septum, but from the left of the aorta, it will go back and until it reaches the this pulmonary vein. On the left side, the blood will go through now the left AV canal into the left ventricle. Here you can see there, you can see right here. There on the back, you can see the opening into the outflow tract. This opening will lead to this middle part behind the septum. And from behind the septum, it will curl around on this side and it will come in the front right here. And that's why in the adult heart, you see the characteristics curl of the ascending aorta. It starts on the back, emerges on the right side, and turns around and comes on the front. That is the pathway that you see of the ascending aorta in the adults. And it comes here, and then there are the aortic arches, and here the aortic arches are going to go back and join the dorsal aorta. And the sinus venous is in the same structure, and I think it's covered here. You can see the intraatrial septum to the two parts that we talked about and all of these structures. I hope that was it. Thank you.